Good evening and welcome to another episode of Let's Talk Business. We have a great show lined up for you tonight, but please remember you can watch us on Facebook, YouTube, and on Amazon Fire TV, and now on KGNG Channel 26.8 TV in Las Vegas. Of course, you can always listen to us on our PHLV radio app or get our podcasts on Apple products, Spotify, and iHeartRadio. Tonight, we are going to talk about Medicaid, specifically Medicaid fraud. And as always, we will have experts who will tell us about it. But before we bring them in, let's make sure our audience at least have a basic understanding of what Medicaid is. So Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to the federal requirements. The program is funded jointly by states and the federal government. Now, Medicaid is such a huge topic, and of course for tonight, we just want to focus on one thing, Medicaid fraud, its effects. Now, what is Medicaid fraud? It's intentionally deceiving or misrepresenting others for unauthorized benefits, which can jeopardize your medical care, waste taxpayers' dollars, and of course, it's against the law. It is estimated that $100 billion annually is lost to Medicaid fraud. Investigators, though, actually suggest that it's much larger than that. In 2022, states were ranked which states have the most Medicaid fraud. Luckily, Nevada is not there. The top 5 is Texas. But I just want you guys to listen to the amounts because it's really staggering. Texas was number 1 at $219.9 million. California, $108.5 million. Florida at $88.3 million. Louisiana, $86.4 million. And Massachusetts at $71.3 million. Unbelievable. So better to learn about this issue, let's bring in our subject matter experts. So we're going to welcome our 2 gentlemen in the show. Our first guest is Andrew Schulk. He is the Chief Deputy Attorney General in Medicaid Fraud Control Unit. And our second guest would be Matt Ross, Deputy Chief Investigator, Medicaid Fraud Control Unit. Good evening, gentlemen. Welcome to the show, and thank you so much for joining us.
Good evening, Sonny. Thank you very much for having us and that excellent intro. And right off the bat, we are going to take full credit for the fact that we're not in one of those top states you mentioned for the amount of fraud being conducted against Medicaid.
That's right. It's all because of us.
From the get-go, we'll go ahead and take credit for that.
I love it. Of course. You deserve that. So, yeah, 100%. Awesome. So, again, thank you for joining us. So, let's start this. Tell the audience, what or who is Medicaid Fraud Control Unit?
Sure. So, essentially we're a pretty unique unit in the sense that we are based out of the State Attorney General's office, but essentially every state that accepts Medicaid money needs to have a Medicaid fraud control unit. So we are actually pretty much a national organization. There are MFCUs in every state now. North Dakota was the last one. They finally got one, I believe, a couple years ago. But we're also MFCUs in territories. We're in U.S. Virgin Islands. I believe they're setting one up in Guam, and actually they opened up the one in Puerto Rico about 3 or 4 years ago. So because of that, again, we're kind of unique in the fact we share a lot of information amongst all of us, amongst the states, about fraud trends we might be seeing, things to be on the lookout for, but also for our civil cases, a lot of times we, as the state of Nevada, are named with other states to essentially try and work these cases. A lot of times they're against large pharmaceutical companies or essentially anybody that's submitting a false claim to the Nevada Medicaid system. But again, we are unique in that sense. Being in the AG's office, we do have jurisdiction statewide, so we obviously prosecute throughout the state. And even though we are the Medicaid Fraud Control Unit and that is in our name, the other, reason that we're put on this earth is that we do also investigate elder abuse and neglect. Also, vulnerable adults as well will qualify. But really, we look at those type of instances where the elderly or vulnerable adults are being abused in nursing facilities, medical facilities, and those type of things. So, and sometimes those also lend into fraud issues as well. So sometimes you've got to get two birds with one stone in that sense. But that's kind of a snapshot of who we are. And obviously, yeah, we are a unit that is filled with all types of various staff, professional staff. We have attorneys, we have investigators like Mr. Ross here. We have compliance investigators, which are essentially investigators that do the work of a sworn investigator. That's the only difference, is they're not sworn. They don't go through the police academy, but we have some amazing compliance investigators that do a lot of great work for us. The management analysts, which are essentially the data people. Obviously, a lot of the Medicaid fraud involves claim data and reviewing claim data. So they are very important in educating us of where our exposure is on fraud and intricacies in the claims themselves, which sometimes can lead to how fraud is identified. And then, of course, the support staff that essentially make sure we operate, function, and do our job on a daily basis.
Oh, wow. That sounds fantastic. There's a lot of a lot of data to analyze, obviously. So
yes,
lots and lots of data.
Yes. No, there are some cases and projects where our analysts say, yeah, it'll take me about an hour to open up that spreadsheet just because of the volume of claims and things like that might be involved.
Yeah, Sonny, I believe there's been some spreadsheets where they actually max out the amount of data Excel can hold.
Yes, there is a limit. If you didn't know, there is a limit.
So I know you touched on this a little bit, but describe us. What are the main duties of the fraud unit?
Yeah, so I'll take that one. I would say we have a four core goals, right, that we really try to achieve. The first one being we investigate and prosecute Medicaid provider fraud. And it's important that I emphasize the provider aspect of that. We aren't going out and investigating recipients that are on Medicaid, the actual people who are out there. If they're committing welfare fraud and maybe lying about their income to get welfare, whatever it is, that's handled by a completely different agency. We're actually investigating Medicaid provider fraud. So the doctors, the hospitals, the psychologists, psychiatrists, the people who are actually submitting billing to Nevada Medicaid or its contractors to receive payment. We investigate them, and our biggest goal is that, right, the provider fraud. The second aspect that Andrea already touched on is the abuse and neglect of elderly and vulnerable people in board and care facilities. So if someone's in a skilled nursing home, a hospital, a group home, even unlicensed group homes, if they're being abused or neglected in any way, shape, or form, we do have some jurisdictional authority to investigate and prosecute those cases. And then on top of that, we also, because we work so closely with Medicaid and their policy, one of our other major goals is to recommend policy changes or ways to improve Medicaid policy to Nevada Medicaid so they can strengthen that and prevent provider fraud. And then the other thing is community outreach. We do a lot of community engagement where we're going out and we're talking to providers, talking to the public, talking to the community, educating them on Medicaid provider fraud, educating them on abuse, neglect, signs and symptoms, how to report, things like that, just trying to really make a dent in this area of criminal activity and do everything we can to prevent it.
And I think real quick, Sonny, on that last point, and that's something that Matt and I, since we've kind of taken over this unit, I mean, we've really highlighted the community engagement aspect of it. And of course, under AG Ford, Attorney General Ford, excuse me, he operates our office under the 5 C's. And one of those C's is community engagement. So we very much want to get out. And obviously, thank you very much again today. This is an excellent mechanism to get the word out about who we are and what we do. And I think part of the benefit of that for our purposes is that there's I don't know if it's a misbelief, but I mean, there's within the Medicaid provider community, some, especially if they're new to it, they might just think, oh, if I get into trouble, Medicaid might try and take some money from me, or, maybe I get a letter from them. Oh, what am I going to do? But we really want to get the word out there. No, there are really serious criminal consequences to this Medicaid fraud, especially when it gets to the egregiousness that we see in our criminal cases. So again, this community engagement aspect of it is really good for us. And for our abuse neglect cases, too. We want to get out into medical facilities and let them know, especially the staff there, you need to be reporting these abuse neglect issues, but also put them on notice that there is a prosecutorial agency out there that will bring criminal charges for those that are abusing or neglecting elderly or vulnerable adults.
No, I love it. Community engagement is great. As you all know, I work for my boss, of course. is so big in community engagement as well. So they have one of the best programs when he was sheriff. So and Metro as well. So how long has the Medicaid unit been servicing Nevada?
So our MFCU was actually created 1996.
Okay.
So it has been around for a hot minute. The original director was Tim Terry. He served for a number of years. He made a lot of great inroads in the civil practice that is actually still used at the national level. And I'm the third director in charge. I've been running the unit since 2019.
Wow, awesome! That's awesome. That's awesome. Now, how does Medicaid fraud affect our healthcare here in Nevada? Now, to me, whenever fraud issues are paid or happen, it takes away dollars from someone who truly needs it. But please go ahead and tell me what's your take on that? Yeah.
No, you're absolutely right. So it affects healthcare in a number of ways. First and foremost, if a provider is fraudulently billing on a Nevada Medicaid recipient, Medicaid is thinking, oh, this recipient's getting these services. And so let's say it's a mental health service, right? And they max out their billing on mental health for the year. Mm-hmm. If they then actually need some mental health services and go out and seek those, suddenly they're not able to get it, or because the provider's like, Medicaid's not paying us because someone's already billed these services under your name. Right. So that is the biggest concern, is that people aren't getting the actual care that they need when they need it because of these fraudulent providers. Another aspect is some of these providers will lie about their qualifications to obtain authorization to provide services under Nevada Medicaid, and they might not actually have those qualifications. They'll falsify diplomas, transcripts, all sorts of things to get authorization. Well, then they're not allowed, they're not even supposed to be providing them, right? They'll lie about their criminal histories. They'll do all sorts of things to get into the system to try and make that money dishonestly. And then, it is going to decrease the reimbursement rates. Medicaid is a limited supply of cash. It's not unlimited, right? It does that money isn't just an unlimited source of funds. So it's limited. And when there is an area where there's a lot of fraud, Medicaid can't pay higher reimbursement rates because they're spending so much already in that area. The other thing to note is that we've seen it here in Nevada, and it's actually happening in some other states right now as we speak, where if there's a lot of fraud in a specific area, Medicaid might put a moratorium on any new providers enrolling in that specific field. So we saw it here in mental health a few years ago. They put a moratorium on it because there was just so much mental health fraud. Medicaid felt like, oh, we need to try to get a handle on this. And so they put a moratorium, temporary, but they put a moratorium on it for a little while so that people couldn't enroll at that time to become mental health Medicaid providers. So it does affect multiple aspects of healthcare here in Nevada.
No, you're right. With that, a good friend of mine who lives in California wanted to open a hospice care, and when he tried to apply, he said, no, they had a moratorium, and they're not taking in new hospice cares. So what is...
And Sonny, just real quick, it's funny you mentioned it, just because we've seen so many instances in our cases where it's, the fraud happens. It starts in California. I mean, when Matt started in this unit, we ran into a situation where there was a whole bunch of individuals coming up from Van Nuys in Southern California and setting up durable medical equipment companies that were just storefronts. I mean, 100% fraud happening with it. But you mentioned hospice. That's the other thing we kind of recently, within the last year, have gotten wind of coming from California. There's the egregiousness and how much fraud is going on down there has already caused a moratorium on hospice providers in California. And this is, again, the benefit of working with our other state colleagues as well as our federal colleagues. We work closely with the Office of Inspector General, Health and Human Services, so the federal HHS, OIG, and they put on this whole presentation for us, kind of warning about what could be coming our way. And obviously, when we get information like that, we very quickly get with our federal counterparts here and with Nevada Medicaid saying, here's what you guys should be on the lookout for. Or, this is some of the warning signs that they're seeing in California, so we can try, and I sense try, or emphasize try and get ahead of some of this. It's very hard, but it is good to have some of those working relationships so we can kind of get wind of some of the fraud that might be coming to Nevada as well.
No, that sounds awesome. Actually, I'm going to interchange these two questions a little bit, if you don't mind, since you kind of touched up on the agency that you... Give us some other examples of agencies that you work with here, both in the state or other states.
So a lot of what we do, because Medicaid is a federally and state funded program, there are a lot of federal agencies that we work with. Andrew mentioned the Office of the Inspector General, Health and Human Services. They primarily handle Medicare fraud, but they also have some jurisdiction over some Medicaid fraud. So we'll work some cases in conjunction with them, and they help us on a lot of specific things, email stuff, all sorts of things they help us with. We've had cases in the past with the FBI. We have a couple cases right now with the IRS and their criminal task force. And then also we work with local law enforcement, not so much on the fraud aspect of things, but on the abuse and neglect. We do a lot of stuff with local law enforcement. And then we've also had the Department of Public Safety Investigations Division help us on cases on search warrants in rural areas and things like that where we need some additional manpower.
And especially on those abuse neglect cases, and again, this is something through our outreach efforts, I think, and even this past year, we've seen a tremendous growth in the number of referrals we've gotten. But working with ADSD, which is
Aging and Disability Services Division.
Oh yeah,
just easier to call them adult protective services.
I don't want to screw it up and get it wrong again. But yeah, they give us a lot of the referrals on what's happening in medical facilities. We could get and as well as the public guardian's office. We've gotten some very good referrals on wards of the state that are essentially potentially suffering abuse neglect issues that, again, we want to touch on and hear about as well. So a lot of good state actors as well as obviously the federal counterparts too.
perfect. So I kind of combined my 5 and 7 questions because they're both asking for examples. That's why I did this. So what are some examples of Medicaid fraud? And believe me, I think I mentioned I just came back from D.C. and I was talking to my brother-in-law over there. He's a dental surgeon, and he was telling me about a case that they had in Washington, D.C., where a dentist was prosecuted for Medicaid fraud to a tune of $4 million. I'm like, what? $4 million? And what does he do? But anyway, please, give us some examples. Yeah.
That's a lot of dentures, Sonny. That's a whole lot of.
Yep.
So there are a lot of different schemes that we've come across. The main thing that we're looking for, our bread and butter, is billing for services not actually rendered. So they're submitting billing to Medicaid for whatever it might be, surgeries, in-office patient visits, anything like that, that actually did not take place. That's what we do 90% of the time. Now, that can take on some different aspects, some different schemes. One of the big ones that we've seen here in the past is just, we call it ghost billing. Essentially, someone makes a company, they register with the Secretary of State, they get a license, but it's not an actual place. They might have a P.O. box, maybe they're running it out of their apartment or their house or whatever it is. They will do a quick Google search and get the NPI. NPI stands for National Provider Identifier. Every medical provider enrolled with Nevada Medicaid is required to have one, but it's publicly available information. They get these NPIs. They'll forge some documents to get these individual service providers links to their company, and then they'll get the names of Medicaid recipients somehow. Maybe they buy them from someone, or they knew them from a previous place where they worked, whatever it is, and they just essentially just start billing. They go willy-nilly and bill whatever they want for a specific period of time, and there's actually no company, right? These recipients don't know about the company. They never signed up for services, and these individual providers, the staff that allegedly work there, don't even know that they're linked because it was all forged and fraudulently submitted to Medicaid. So we call those ghost companies, and it is really just a factory for these bad guys to make some money. And it's a lot of times they'll put other people's names on the ownership paperwork. They'll register other people as the owners with the Secretary of State. And so for us, it's really comes down to, like you see on TV, tracking the money, right? So we go and we get the bank account information, and we look to see where all of this money is going, who is actually benefiting from the fraud, and that really helps us figure out who is responsible. So that's just one example, but we see a whole bunch of different things. I had mentioned faking your qualifications to obtain authorization to provide services. We've had cases where people will fake transcripts. They'll take someone else's transcript or diploma, literally white out their name and put their name on it.
Very creative.
What's that? I'm sorry.
Very creative.
Yes, very creative. One of the other things we see a lot is there are specific criminal convictions that prohibit people from providing services within Nevada Medicaid or from becoming a provider. So a lot of times bad guys will lie about their criminal history and fail to disclose that to Medicaid. So Medicaid thinks they're on the up and up when that's not actually true, so that they can obtain authorization to provide services. Some other things we see: upcoding. So there's specific billing codes that have like a time, right? Like a 30-minute time period that you must provide services for 30 minutes. Well, let's say that the doctor provided services for 15, which is paid at a lesser amount. Well, they want to make that larger amount, so they'll upcode it to 30 or 45 or 60 minutes, right? So they upcode their Medicaid claims so that they can make a larger amount of money. We see cloned notes. So here in Nevada, all Medicaid providers are required to maintain records to support the billing that they submit. And if they don't do that, not only is it a violation of Medicaid policy, but it's against state law. And so a lot of times when we go to these providers' offices or request records, they will have what we call a document party, and they will just make up a whole bunch of records because they want to satisfy our request, but they didn't actually have the records. And so when that happens, it's funny, when I first started, I was always like, no, let's not request that and give them 2 weeks to make these records. Let's go in there, let's do a search warrant, excuse me, let's do a search warrant, let's kick the door and let's grab what we can. I didn't want them to get away with it. I've learned after so many years of doing this that it's actually beneficial for us. Give them some time. Let them make those records, because what they'll 9 times out of 10 do is copy and paste over and over and over and over and over again, right?
So you'll catch them anyway.
Yep. It really helps our cases along when they decide to do these document parties and just go for it and make all these records up. One of the biggest things we've seen, and it's probably the most problematic financially for Medicaid, is consulting companies. So a lot of times we will get these individuals who we've convicted, who have been problematic in the past, have a history of Medicaid fraud. And so once you've been convicted of Medicaid fraud, you're put on what's called the exclusion list. Nevada has an exclusion list, and the federal government has an exclusion list that the Office of the Inspector General maintains. And then once you're on that list, it prevents you from becoming a Medicaid provider. And it ranges in how long you're on the list. It can be permanent. It can be 3 years. It can be 7 years. There's different levels. But it's not just you can't be a Medicaid provider. You also can't provide Medicare services. It really prevents you from being involved in any healthcare facility or healthcare provider that accepts Medicaid or Medicare money, like down to the point where you can't even be the janitor at one of these places. It's pretty serious. Yeah, it's pretty serious. Yeah.
Well, it should be. I like it.
So what happens is if we convict someone and they realize, oh, wait, this is such a good way for me to make money. I want to keep doing this, but I can't own my own company, right? So a lot of them will start consulting firms where they'll have seminars at like station casinos here in town, and they'll invite all these people and say, hey, if you want to own your own business, come see us. We'll teach you how to do it. And they were literally help these people set up companies, promise them that they're going to make hundreds of thousands of dollars, usually every month, and say, we'll set everything up for you. We'll even do your billing. All you have to do is pay us, 10, 15, 20% of whatever you take in. And these people are like, this is great. I've never seen this much money. I'm going to trust these individuals and go for it. Put my name on the paperwork, show me how to do this. And so these prospective business owners think everything is great. They're making all this money. They trust these individuals, when in reality, these bad guys have access to your billing. They're submitting the billing and they're overbilling a substantial amount, right? They're billing hundreds and hundreds of thousands of dollars, because then they're going to get 10% of that. And their name isn't on anything. Their name isn't on any of the paperwork. It's on nothing. And so we've seen an explosion in those types of cases. And they are big cases, and it takes us some time to work through because there are so many layers, right? You got to think of it like an organized crime ring.
Yeah, I was going to say.
Levels, right? There's levels that we have to work up to get the big fish. And truthfully, we get the little fish too. Like at some point they realize, wait, I shouldn't be making, $100,000 a month when we have 2 clients. That doesn't make sense, right? But the money is so good that they just keep going with it and just put their heads in the sand and pretend like nothing bad is happening.
I'm glad you said that, because I was gonna ask you that. They should get in trouble too. Essentially, they're the front.
hook. Absolutely not.
No. And that's the thing, and especially when we're doing these systematic fraud type cases, like nobody's getting a pass. Like, I mean, everybody's involved to a certain degree, and our evidence shows that at a certain point in time, and a lot of times we're talking about these business owners, and especially in the arena of behavioral mental health fraud, where they're sold the dream, and that's the unfortunate part. A lot of these consultants companies or these individuals are using mechanisms like they go to church and they go to their fellow churchgoers. Hey, do you want to be a business owner? They prey on, some of the more vulnerable members of our community and saying, hey, you've never made this amount of money before. What if I told you if you just signed this application, you could be bringing in, as Matt said, hundreds of thousands of dollars a month? And they'll sell the dream of being able to run your own business and make all this money. But at some point, and we've brought these business owners in here, and they've been very upfront with us about it, is that at some point they realize, wait a minute, I don't have people coming in the door. I don't have clients. Like, how am I making all this money? Like, where's all this coming from? And then again, the follow-up questions are like, what did you do about it? Did you ever ask about it? Did you ever try and stop it? And then they're like, you know what? I got so used to the lifestyle and making all that money, I just went along with it. And in the same, well, not the same vein, but a similar vein with the Medicaid recipients, a lot of them are sold this dream or belief or whatever, like, hey, we can hook you up with all these other products. We can get you to a food bank. We can give you a bus pass. Like, we can give you $20 just to sign this paper. And what the recipients don't know is that these providers are just looking at a way to get that Medicaid ID number. Once they get that ID number, they can go to town and bill and get paid, because the other part of kind of the blessing and curse of our job is that Medicaid does not give an explanation of benefits to recipients. Like commonly in private insurance, when you go to a dentist or a doctor, you'll get an EOB that says, here's what we did today and here's what we're going to submit to your insurance. Medicaid does not do that. So a Medicaid recipient has no idea a lot of times what's being billed under their number. And so there might be some times where Medicaid, in fact, we just had Medicaid testify in a case for us earlier this week, and so they talked about this. Like, Medicaid will send out randomly 500 letters a month to recipients asking them if they've got this service. Well, when you talk about the hundreds of thousands of Medicaid recipients that are in this state, you're hit and miss if you can even get it to somebody that's going to had a service that they're, and the most important part, reply back to Medicaid. The response rate on those things is about 10%. So it's just, to a certain degree, the system is ripe for fraud, because there's so much that these recipients and some of these individual service providers do not know what is being billed under their name and number. And obviously, especially for the individual servicing providers, we have to start there in our cases. We have to make sure they're not part of the fraud. And sometimes we're going there as like, I've never heard of this company before. And so, but we got to start there to work our way up to the company. And again, that is, especially since I took over, we've really shifted the unit's focus to really taking down some more of the whole companies that are doing the systematic fraud. I mean, we have the individuals that are out there doing it as well, the personal care aides, even these individual behavioral health services, but we're really trying to get to the problem. And some of these, again, companies making millions of dollars a year that are just, they're not doing these services.
Yeah. I'm betting they're the bigger impact anyway. So, yeah.
Yes.
So what are the top medical fraud that we experience here in Nevada?
So it's funny you asked that. So Andrew mentioned that when I got hired back in 2011, there was a big explosion in durable medical equipment. Okay. So that's companies that are providing diapers, underpads, wheelchairs, things like that to individuals. And that's really the reason they hired me. They hired me to investigate those types of cases. But as soon as I got on, apparently I scared all of those fraudulent providers away, because they all disappeared. And since that time, more than a decade now, our biggest problem has been in the mental health arena. It is these individuals enroll these companies with Medicaid, and they essentially have found loopholes in the system, and they go to town on the billing. And it has been constantly since that time, I'd say 90% of our cases have been mental or behavioral health fraud cases.
90%.
And I think especially in mental behavioral health, and the I guess to a degree, frustrating part with us is we have a number of cases, both that we've completed as well as current ongoing investigations, that are individuals that have either already been excluded from Nevada Medicaid because of fraud, or that we've previously convicted because of fraud and have gotten themselves excluded, but then go into, as Matt was talking about, these consultant type things to try and remain on the periphery and not on the Medicaid documentation, because obviously as an excluded person you can never do that. But especially in this arena of behavioral health, the money is so much, and it's to a certain degree, pretty straightforward in how you can get it from Medicaid, that the deterrence of even our convictions or even getting these people excluded is not as much as it used to be. And we did get some good jail time on a case a year ago, and obviously got a press release out about that to see if that helps and maybe get some deterrence, or some of these people thinking twice about getting back into this industry after they already got booted for fraud. But we continuously see some of the same players and actors, even once we've already, again, convicted them, still out there and about and still trying to get their hands on some of this Medicaid money.
Wow. Whew. That's a lot to tackle, man. I thank you, both of you, big time. Now, can you give us, and you, Andrew, you kind of touched on this a little bit, but can you give us an example of how being proactive has really helped the state prevent Medicaid fraud?
Sure. And obviously specifically for what we can do at the MFCU to try and help in being proactive about Medicaid fraud. I mean, commonly when we do our outreach, but even when we're doing interviews with Medicaid providers and recipients as part of our ongoing cases, we very much, spread the word, and we kind of use this phrase: you have to police your Medicaid ID number. And that goes for both your provider number, if you're a provider in this state and your number is being billed as if you're providing services, but also as a recipient, if you're having services billed under your number as a recipient. So, essentially getting the word out about how these providers can use your number without you even knowing it. Like Matt mentioned the NPI number. You can go on Google right now and get anybody's NPI number out there.
Wow.
It is not protected information. It is out there on Google. It is super just to go out there, and then you fill out this one form to link that number to your, fraudulent business in Medicaid, and you're off and running. So the more that we can get out about policing your number and essentially telling these providers, look, you should probably be checking in with Medicaid. Like how often, that's up to you, but there's ways through Medicaid's portal, through contact information, that they can reach out and get an accounting of essentially what's been billed under their number. And that goes for recipients and providers. And then, of course, bit selfishly, but the part we want to get out of that conversation is, look, if you find that fraud's been done against your number, give us a call.
Yeah.
We want to hear about those type of cases because, obviously, without jinxing ourselves, a lot of times those are very straightforward cases. Like, I did not do those services. I did not receive those services. And then we'll just work on proving the fraud afterwards. But I think to us, the best way to be proactive about it is just police your number. But I guess the other thing too is, if you're approached by one of these consultant companies or by anybody about, opening one of these businesses or even working for one of these companies and being told, you don't have to worry about doing all that documentation and all that paperwork, but you're going to make a hell of a lot of money. Like, if it sounds too good to be true, most likely it is, and you should not get involved. Because, and again, we hear it all the time with our defendants we convicted. I really wish I wouldn't have picked up that phone, or I really wish I wouldn't have gone to that meeting. But once you're in, and again, some of these consulting companies or some of these, puppeteers that are out there puppeteering the fraud, once they got their hooks in you, because you're on all the paperwork as the owner of the company, when it comes down to the requirements of the documentation, need to have, accurate claims, that's all you and the individual of the company. So obviously the evidence for us is already there against the owner. And these consulting companies and those things like that know that too. They're setting these people up. So again, I think the more we can get out about policing your number, ask these important questions. And again, if something sounds fishy, if you find companies that have billed on your number that, I did not get those services, did not work for them, give us a call. Or call Medicaid, but give us a call too.
And Sonny, one of the other things I think is important to note is our unit, we're not out there actively reviewing claims data, looking for outliers or things like that. We call that data mining, and the federal government actually prohibits us from doing that. So we work almost entirely off of referrals and complaints from other agencies, from Nevada Medicaid, and from the public. And just like all police work, it has to be a partnership with the public, right? We can't do what we need to do to fight these bad guys, to get these bad guys out of the system without the public's help. So like Andrew said, monitoring your number, reporting things that seem too good to be true, that seem strange. If it feels off, it probably is off, right? Everyone has that little spidey sense in the back of their mind that something tells them, something whispers to them, this isn't right. Listen to that. And please make the report. We're not asking people to go out and do their own investigations into these things. Yeah. That's our job. But if we don't know about something going on, there's no way for us to find out about it without the public's help. So it's really important that people are paying attention, monitoring their numbers, policing it, like Andrew said, and then letting us know if they see something that's off, so that we can figure out what's going on and do something about it. And I'll be honest, it seems weird to only work off of referrals and complaints. It seems counterintuitive, but the truth is there is so much fraud.
Wow.
Even here in Nevada, which wasn't one of the top 5 states you mentioned, there's so much. We have more than we can handle. It is like a fire hose being turned off and just constantly spraying Andrew in the face with fraud referrals.
I used to have hair when I started this.
Hey, I just noticed that. That's right.
Yeah, totally. That's true. I just realized that. Yes, Sonny, all 3 of us are lacking.
We're working with the state. No PSA needed for that.
All right. So my last 2 questions here, because we're running out of time. But what would your best advice be for the community to stop Medicaid fraud? And I think you've already said a few, but just a solo question. Go ahead. Yeah.
Be aware. Well, I guess first and foremost, don't commit Medicaid fraud yourself.
That's a good idea.
It is an easy trap to fall into. But if you think about it, these healthcare professionals have spent years of their lives and tons of money to get the degrees and the qualifications and the education necessary to do what they do, right? To become healthcare providers. Mm-hmm. And in a blink of an eye, make some bad decisions over a small period of time, lie about the services you're doing to make a few extra bucks, and suddenly all of that can go away, right? All that time and energy and effort that you put into, say, becoming a doctor can go away just like that. When you commit Medicaid fraud, you get convicted and you're added to these exclusion lists because now you can barely work anywhere at all. So that first and foremost, don't do it yourself. Second, report it. Be aware and let us know. We have made it really easy. You can report things anonymously. You can give us a call, but I think the best way to report things to us is we have an intake email address. It's mfcuintake@ag.nv.gov, and I'll repeat that one more time for your listeners, mfcuintake@ag.nv.gov. You shoot an email over to us, brief description of what's going on, your contact information if you want to hear, so that we can get some more details if we need to. Our intake people will probably reach out if there's not enough information in the email itself, get some more details, and we'll start down the road of figuring out what's going on there. And please, even if you're not sure that we would handle it, if we get a referral that we won't work ourselves, but we know the other agency that would, we will send those referrals out to those other agencies to make sure that those things are being addressed, and that things are going the way that they're supposed to be going. So really, that's it. Don't do it yourself. Be aware of what's going on and report the things that you see.
Wow. And yes, and I would just add, Matt said it all, and again, I know I've kind of already talked about it too, but yeah, I think at the end of the day, like if we're not getting a call or hearing about it, there's not much we can do. And so being proactive in the sense that, if you're hearing about Medicaid fraud going in, if you see your neighbor that you know is supposed to have one of these personal care aides coming every day to provide services to that person in the home, and you see that there's nobody coming and that person's alone by themselves all day, make a call. And that's the thing. I mean, and even if it's something that, maybe not rising to the level of something that we can do anything with, we don't sit on those referrals either. We will send those referrals to Nevada Medicaid. We will send them to state licensing. Like, we will ensure that even if it's something that maybe we can't investigate, and obviously we get calls about Medicaid recipient fraud all the time. Sure. People saying that my neighbor makes way more money than they're claiming, they shouldn't be on Medicaid. Well, unfortunately, that's not what we do, but we do not turn those people away. We essentially just get that over to welfare so they can do their investigation. But as Matt said, like, if we don't hear about it, there's not much we can do. So just being proactive in reporting these things, even if it's just a hunch. I mean, some of our biggest cases started with just tip of an iceberg, one call regarding 1 or 2 recipients that turned into millions of dollars of fraud. So I guess that's the other thing too. Don't think that what you might be stumbling upon or seeing is, this is so small, it's not worth their time. Again, it might be tip of the iceberg, and you might help us uncover a whole lot of fraud that's been going on for a lot of years.
Awesome. That sounds great. Gentlemen, I cannot thank you enough to both of you for coming. We're here to help. However we can help you spread the word and your community engagement, just let us know. But thank you again. And one more time before we leave, how can they send you a referral?
The email address is mfcuintake, INTAKE, @ag.nv.gov.
Awesome. Thank you very much again for joining, and take care.
Thank you, Sonny.
Appreciate it, Sonny.
Appreciate it.
Thank you very much.
Take care.